So it was probably 8, 9 years ago. I just started noticing some pain in my knees, and it just gradually got worse. Started in my right knee, didn't have hardly any in my left knee. Then it went on, and it got to the point where I was, I could hardly walk right. Going upstairs was really painful. Coming down was worse. I mean, you put up with the pain because you think it's not that bad. It's not that bad. There's people that are a lot worse than I am, but you're not sleeping at night. Every time I rolled over, I woke up from the knee pain, because if I sat in one place for too long, it hurt. If I used it, it hurt, so it was hurting all the time.
How are you, man?
My wife was the one that finally said, it's time, go to the doctor and get a referral, and she said, but you gotta go to Dr. Hartman.
Matt had advanced arthritis in both of his knees. He had failed conservative treatment. We talked about the option of total knee replacement. He was very interested in returning to an active lifestyle, and so I thought a knee replacement was a very good option for him. We want to make sure that we've tried all other treatment modalities prior to recommending surgery. He was unable to do the activities that he really wanted to do. He was struggling to do recreational activities. Most patients with arthritis this bad have trouble sleeping at night. It's difficult for them to do their job, and so, usually by that time they're willing to consider having a major operation to relieve that pain.
Close to the time of the surgery, if I could walk to block, I would be in a severe amount of pain. When I did get out, and if we went anywhere, we went to a football game or something and was walking around, by the end of the night I was miserable.
We did one knee in January, and then about 6 or 8 weeks later we were able to do his other knee, and he's really done quite well. This used to be an operation where people were in the hospital 3, 4, or 5 days at a time, and over the last 5 to 10 years that number has really dwindled now to the point where in many places this is an outpatient procedure. Most of our patients stay overnight one night and then are able to go home.
I would never have been able to take the job I did where I'm doing a lot of walking, and because back then I couldn't walk at all. Just to walk across a room was painful. Both my wife Sue and my daughter Marissa, they both said, and I didn't realize how bad I was, how crabby I was all the time, and I was obviously in pain, wasn't sleeping well. And after the surgeries were over, they say, you're just a different person. You're just more relaxed. You can tell you're not in pain anymore. It changes your whole lifestyle, because it doesn't limit what you're going to do, where you're going to go. You can just do whatever you want to do, as you did before all the knee pain started.
In his situation, at 6 weeks, he was able to turn around and do his other knee replacement. And so, I think that's a testament to how well patients recover and how quickly patients can recover from knee replacement.
You kind of feel bad because you want to get out of the hospital, but everybody's so nice and taking such good care of you. You feel like, it's not you, I just want to get out of the hospital. But the care out here is fantastic. There's no place else, if I had to do it again, no place else I'd go.